Welcome to Dr. Sellers Educate. We're thrilled to have you back with us. We know that each of you may be at a different point on your journey, and that's fine. The good news is, in case you don't know, and this is your first time tuning into our channel, we are here to support you until you are successful. Our mission is to support every nurse educator to achieve success with certification by the NLN. So for some of you, that may be the CNE, others, it may be the clinical CNE, and others, the novice CNE. In case you're not familiar with the eligibility criteria, that is step one. Go ahead and head over to nln.org. And if you scroll over to the right, you're going to see a tab for certified nurse educators. That's going to be one of the critical first steps in your process to determine whether or not you meet eligibility criteria. If you have any questions, NLN is a wonderful resource. They are very responsive, so go ahead and send them an email, or you may want to give them a call. At Dr. Sellers Educate, we only share recommendations and content that's aligned with NLN standards and competencies. So if you've taken one of our review courses, great. The good news is you have unlimited, indefinite access to that information. If you can't locate your login information or you can't locate that content, just send us an email. That's going to be info@drsellerseducate.com. And we will be happy to provide some additional access for you or to give you that information. And then timeline for the retake. We're going to spend quite a bit of time focusing on that specific area. All right, so reflect and refresh. So looking at the competencies, that's going to be step one. That is the foundation, that is the framework to help you be most successful on the exam. That's exactly what we use for our review. Go ahead and take a moment before we go any further and click subscribe. All right, we want you to be here with us every week as we release content, and click on that bell as well. That's going to notify you every single time new content is released. We don't want you to miss not 1 minute of content as you continue on your journey. All right, so competencies, that's the framework, that's the foundation. You want to have a good understanding of which competencies were unclear for you. Maybe they're the same as when you took it the first time or the second time, but maybe they're different now. I want to go ahead and point this out. We do recommend that you take a new review course if it's been a year or longer. Okay, so if you took a review course in January 2021, we recommend you go ahead and take a new review course, whether that's with us or someone else. And there's a couple of reasons why. Number one, we want you to have updated content. Now, the handbook was released in 2021 by NLN. So it could be that you still have relevant content as part of your review, but we don't want to make any assumptions. Okay, so we recommend you take a new review course. And then second, we want you to think about the experiences that you've had as a nurse educator over the past year or whatever time period it was between the time you actually took the exam and the time that you plan to retake the exam. We know that it's frustrating and disappointing when you're unsuccessful, but we want to support you in moving past those emotions and that mindset. So how we do that is exactly what we're talking about today. And then the second component you want to look at is your scoring report. All right. So like I said, that's content that others don't have that have not already taken the exam. You're going to review that scoring report and determine which competencies you scored poorly on and determine if they're the same ones or if they've changed. The timeline, that's next. Glad you asked. That's a very common question that we get. We recommend a 4-week study plan. Now, the reason why we recommend 4 weeks, there's a couple of reasons. Number one, that's going to give you time to really process the scoring report that you already have, taking a deep dive and looking at what specific competencies did you have gaps in and whether or not those gaps continue. The second reason, we want you to have time to really close those gaps, to hone in on those specific competencies, right? We're going to focus on the top 3. But at week 4, but we want you to hone in on all of them, okay? Because depending on, again, how long the time has passed since you took your first exam and you completed your review is certainly going to factor in to the time that you need to study. But we believe that this 4-week study plan is going to get you in a position to be successful when you retake the exam. If you have any questions or you want to clarify any of these components that we're referring to, go ahead and send us an email. All right, we'll be happy to sit down and talk with you about what your next step should be. Remember, we offer a complimentary 15-minute coaching session with each of you. So you want to take full advantage of that as well. You can just email us again. That's info@drsellerseducate.com. All right, so week one, what are you going to be doing? Reviewing your score report, taking that deep dive, doing that self-assessment, being honest with yourself about where you are. And then you want to quickly move into competency 1 and 2. We know that that covers more than 1/3 of the exam for C&E, but also for the clinical as well as the novice exam. There's a large percentage that's related to facilitation of learning. So you want to hone in on those content areas. There are several YouTube episodes that we have now numbered for you to make it a little bit easier for you to locate them to, again, help close those gaps. So you can see here the episodes that we would recommend for competency 1 and 2. Competency 3 and 4 is where you're going to focus on for week 2. Now, this is tailored for C&E, but you can certainly break this down for the clinical exam and for the novice exam. Okay, so essentially 2 competencies per week. And then you want to focus that last week on what we call a wrap-up week, honing in on those remaining top 3 gap competencies. And for those of you that already know that facilitation of learning is still a gap area for you, then perhaps you want to spend 2 weeks focusing on that one or those 2 competencies. But again, it's really important that you spend time studying all of the 8 competencies for C&E and all 6 of them for clinical and for the novice exam. All right, so week 2, you're going to be looking at modules. Again, that's from your review course. If you don't have them available and you did take them here with Dr. Sellers Educate, just go ahead and send us that email. All right, and then you have week 3 where you're focusing on competency 6, reviewing that content, and then also competency 7 and 8. Okay, so you can see that we've kind of grouped the competencies together for weeks 1 through 3, because the goal is that you're covering a couple of competencies a week, and you may go faster, you may go slower. It just depends on your gap area. This is a guideline for you. There may be variations depending on where you are. But most importantly, as I mentioned, week 4 is that wrap up week, looking at the 3 main gap areas, all right, and then reviewing content related to those 3 gap areas in Billings and Halsteading. All right, so just to wrap up, you're going to focus on the top 3 lowest scoring areas. You're going to sign up for coaching or mentoring with your colleague, but we do offer coaching for you as well. And then just taking some time to do that honest self-assessment of where your gaps are. As we said, each of the exam questions have what we call a 3-part approach. The first segment is going to be a fact, the second is going to be a scenario, and the third is really the question or the application of your knowledge. So ask yourself, as you're looking at every single question, what is the question asking exactly? And what answers can I eliminate? Sound familiar? So we hope you're not feeling like this. There's lots of content, there's lots of resources, but we always want to hone in on the key resources that we recommend. Number 1 is going to be that NLN candidate handbook, right? That is our guideline as we move through the process of closing gaps. Number 2 is going to be that detailed test blueprint that is in the handbook for all 3 of the exams. So you want to make sure you have that as your second resource. You want to print it out if you haven't already. And then third, you want to purchase your resources. What are they going to include? Billings and Halstead, Teaching and Nursing, Dr. Caputi's C&E Review Book. Those are 2 great resources to start with. And then there may be others, but again, those are the primary ones that we recommend.
Hi, this is Dr. Stella.
If you haven't, it sounds like you have, because many of you are. The largest gap areas that we've seen our nurse educators struggle with, the ones that we support, is related to these 3 main areas. Curriculum. The reason why, oftentimes there can be minimum experience associated with development of curriculum. So the lack of involvement, lack of experience really does position nurse educators to have a large gap area related to curriculum. The good news is many nurse educators that have been successful have reported to us that there are really no surprises as it relates to curriculum on the exam. The other good news is that all of us have curriculum committees, right? We're certified or accredited by regulatory bodies that require us to have a very prescriptive curriculum. So use your resources, your internal resources, your colleagues. All of us have faculty that are really good in curriculum. And so we want to leverage their expertise and use them for our benefit. So talk to your colleagues about curriculum and to help you close those gap areas. Second is item analysis, reason why is limited experience. And it can be difficult to understand. There's so many components in the item analysis. There's so many considerations as you determine whether or not it was a fair and reliable exam. So the good news here is that you already have resources available to you. Here on our YouTube channel, we have an item analysis video. And also in our monthly boot camp, we have completed 2 sessions on item analysis. The good news is also that you can easily access that right now if you go ahead and go over to our website and subscribe and register for our boot camp. So it is a monthly subscription. You can cancel at any time. So I encourage you to do that if that's a gap area for you. Third is facilitation of learning. Now, even though oftentimes many nurse educators feel like that's not a gap area for them, they pretty soon realize that maybe education theory isn't one of my strongest areas. Maybe I don't quite understand all the levels of Bloom's taxonomy and what teaching strategies I should integrate and how I should evaluate students for that level of learning. So you want to make sure that you identify what your largest gap areas are. If these 3 are not relevant for you, great. And if they are, that's okay too. Hopefully you'll have a better understanding as you move forward over the next 4 weeks as part of your 4-week study plan to retake the exam. All right, so just a little bit on exam analysis, point by seal index, reliability, item difficulty. These are core concepts that you must understand to close the gap for the C&E exam, okay? Not for the novice and not for clinical, this is only for C&E. If these terms and this content looks unfamiliar to you, I'll see you over in the boot camp test questions. All right, so YouTube videos, again, this is a great resource for you. Okay, too, I think you probably walked away with some tips and tricks that will help you on your journey as well. You want to review all of the YouTube videos. I know that's a lot, but go ahead and schedule time to do that because it's available content for you that's free and that is aligned with NLN standards and competencies. You want to purchase the study workbook. Again, it's a resource that's available to you. It's easy to follow. It's digital, so you can choose to print it out, but most nurse educators are using it online as it is and just scrolling through the content. Register. Go ahead and register to retake that exam. You will be ready, right? Because you're going to have that solid 4-week study plan. You're going to do the work. You're going to focus. You're going to prioritize. I know that with teaching, there's so many situations that are out of our control. But you just have to control what you can control. If you get off track with your plan and you need to push forward your date, just let NLN know, okay? They're usually pretty flexible, but again, you just want to communicate with them. Another big next step is to sign up for the monthly boot camp and join live, okay? I know that that specific time may not be good for you. They all happen on Saturday. There is a recording, so you do have the content that's available, but if you're retaking the exam, I want you to try in your best way to join me live. It's going to give you a chance to develop that community of support. It gives you a chance in a smaller group to ask questions and hopefully to expand your knowledge or either to validate that the knowledge that you already have. And you can cancel anytime. That's the other great thing about the boot camp. You can show up, for one live, you can have access for 30 days, review all the content, and then you can unsubscribe or cancel your subscription. So it doesn't get any easier than that. But I want you to move forward and take action. We hear back from many of our nurse educators, and we want to hear back from you. You can see here that we heard from Randy K, and we heard from AK that they both passed the first